My first teacher in paediatrics, in the first week of my houseman's post, was none other than a ward boy. So they made me continue work for 2 more years. I asked them that, is it a punishment for me that I did not do a good job? And therefore, retrospectively, I thought I could have been a better lawyer. Happiness is what you feel. Success is what others make you feel. And this is the biggest difference. And success, if you go after it, you might get ruined.
So in this journey of inspiring the new coming generation of doctors, I bring about this very eminent person on our interview sessions. In this second episode of Doctors Outside Hospitals, I bring to you Dr. Yashwant Amdekar sir. This person needs no introduction. Sir has been directly or indirectly being a teacher of almost all pediatricians in our country or even abroad. With n number of publications to his name, as well as so many academic as well as non-academic books published by himself, he has built his academic excellence over the last 53 years of practice in the field of pediatrics. So without wasting much time, let's get into the conversation and hope this insightful talk will definitely open up your eyes. Thank you. Good morning, sir.
Good morning.
Thank you so much that in such a short notice that you've agreed to take this short interview. So this talk mainly is focused towards keeping academics aside and bringing out your mindset into the youth who's trying to get into the field of medicine.
That's right.
And how your thought process will help them to maybe improve as being a doctor, more than being a doctor, more than being a person behind the doctor, in which we aim of giving a holistic care for the patients. So just to be as an icebreaker, I just want to know, who is Yashwant Amdekar as a person outside the hospital?
Well, I think as a person, I thought that I had a very strong cultural heritage because I came from a very large family, and at one time we were 4 generations staying in just 1 bedroom hall kitchen all together, and that taught me a good lessons of how to be a good person, because we had to learn give and take, we had to learn how to cooperate with each other, we learned how to help each other, we learned how to share good and bad issues in the life, and I think that taught me to be a reasonably good person. With the result that when I started looking at others, like together to begin with my colleagues, thereafter my juniors, further my students, I started looking at them as a big family, and I thought I should behave the same way that I was nurtured in my family, and I think that has helped me a lot as a person. Well, I must have made mistakes, every human makes a mistake, but I feel that even if we make a mistake, we should kind of accept it, reason out why it happened, and take care that it doesn't happen again. I think that's what I aim to be a person. I'm not sure how much I have succeeded, but I'm aware that I need to improve every day possible, and I cannot be perfect anyway, but still, I think the first thing for any improvement is to know that you need to improve. And I think that I have learned. So I suppose I would leave it to the rest of the world to assess what kind of human being I am, but I am trying my best.
Excellent. So very well said, sir. So most of the people around, most of the pediatricians have known you as a mentor, as a teacher. Very few people must have known your childhood, your college life, your early medical career. So just give us a brief of how it all began, like where was your schooling, your college life and initial medical education?
I think I must tell you one thing, that I was never the first in any time in my life. And I don't regret that, simply because I couldn't have had an ego of being so good. In fact, I had always a feeling that I am not as good as many others in my class. That made me put more efforts, and I wonder if I was the first, I may not have put more efforts, and I would have been depressed if I became a second. I must tell you a story that one of my classmates was always the last. I was reasonably within the first 10, maybe sometimes within the first 5, but never first. But the child who was with us as a child, and he was in my class throughout the whole school period, he used to be last always. But every time after the result, when some of us met and had a party, he would be the first to be there. Once I asked him, don't you feel ashamed that you are always the last and you are failing? He said, well, that is what has happened. Why should I not enjoy? But one thing that he told me really made me understand how everyone looks at success or failure. He said, I am the last in the class. Therefore, I am not worried of losing my number. Whereas you are all worried whether you would go down. I will never go down. If at all, I will remain the same or I will improve. I thought, what a positive attitude, though not right, being the last. So I think my childhood started with that, and I had many friends. We were lucky to be staying in an area where majority of us went to the same school. So it was not the school friends, but it was the home friends, it was the whole life friends, and therefore many came from a larger area outside our school premises, but most of us, 80% of us, were within a mile of each other. We met every evening. We went to the school ground to play every evening, and therefore I think that bonding, and more than bonding, while playing, getting defeated, sometimes winning, made us no difference because we were friends. If somebody won, I lost. I was happy he won, and when I won, I was happy I won. So there was a kind of a camaraderie, and I think that was my early childhood. Of course, at home I told you that with 4 generations, there were freedom, at the same time a very strict monitoring of what we are doing. A combination of giving us freedom and giving us also a good eye that we are not going astray. But of course, at that time, most of us had no opportunity to go astray. Today you will be surprised that we have our school batch association, even today. We meet once a year. I left the school in 1957.
Which school?
It was the King George School in Dadar. And today, about 30 of us meet once a year, and we are going to meet this 6th January. We meet in our school compound. They give us a hall to meet. We have a small 3-4 hours gathering. We also have a union of our Grand Medical College batch. We passed out in 63, 6 decades ago. We meet once a year, and I think that kind of a happiness makes me very happy. And then of course I joined a medical college and thereafter became a staff, and that helped me to nurture every student of mine as my friend and not a teacher-student relationship. Teacher-student relationship was restricted only during working hours. After the long round for 3-4 hours, we used to meet in a coffee club halfway through the round, take 15 minutes break, because our rounds would go on for 4 or 5 hours. We would take a break at about 12 o'clock, and many other units who had finished their work round by 12 o'clock would join us for a coffee. And that coffee club was an excellent place to talk about everything other than medicine.
Right.
And we knew each other, we knew each other's families, and that made me even attend large number of weddings, opening inauguration functions of their clinics of my students. I'm so happy, and you are one of the example that I meet now, the next generation of my own colleague who at one time was my student, but what a bond for decades to come. And I think and I have had a wonderful time to learn from my teacher Dr. Udani, and I continue to learn today from his son, who is a big neurologist and who was my own registrar for 2 years. I don't think anyone has had an opportunity to learn from the father and a son, and the son was also taught by me. Wonderful experiences of our life as I go on to see and kind of reminiscence what has happened throughout my childhood, school career, college career, and thereafter this. And lastly, when I was to retire at the age of 58 as an honorary professor, least I knew that some of my students who had a kind of a contact with politicians in the government had already pleaded for my extension. And I was given a farewell, and after a week I got a letter from the government of Maharashtra that as per your students' request, we are happy to extend your tenure by 2 more years.
Okay.
Look at the kind of attitude my students had towards me. I don't know how to thank them. Even today I am in their contact. So they've made me continue work for 2 more years. I asked them that is it a punishment for me that I did not do a good job and you better do it for another 2 years? And thereafter the government asked me to continue further. The government finally told me, can you teach once a week after 6 in the evening? And I said yes. And I told them only one thing, that I would have a team of teachers to come together. I would call anyone and I would allow any student who wants to come. It's all free for all. You must give me that kind of freedom. They said yes. That was the year 2000. After 60 years of my tenure there, my age, and 2 years of more extension, I started a Thursday clinic from 6 to 8, where I call anyone, I call every teacher who wants to teach, I call any student who wants to learn, and you'll be happy that it's 23 years down the line, we are about 7-8 teachers who come together and teach. So that's my whole kind of life throughout childhood education, and thereafter as a teacher, as a student, and all that.
Excellent. Very well said, sir. I'm pretty sure most of the pediatricians in the country and even abroad know who you are, and they have learned directly or indirectly something which they use in their daily hospital practice. Many of them idealize you like the father of Indian pediatrics. What are your expectations from this generation of doctors who you have trained, who are the next teachers who are building up the most recent generation of pediatricians? What are your expectations from them, sir?
See, I look at my all students very watchfully, but I'm not expecting everyone to do what I feel they should do, for the simple reason that what I feel they should do, they may be knowing better how to even do better than me. So my views are limited, my views are restricted, my view is narrow vision, and I feel that narrow vision is the most ideal vision, but I am also aware that some others may have their own reasons not to follow me completely, maybe occasionally not to follow me at all. So I don't blame them for not following my ways of working, but I am very happy to say that not all of them have done that. Quite a few have done exactly what I wanted them to do, and to my mind they have even excelled more than what I have done. And one of such person is your own father. Okay, he has risen to such a high academic level. He is still a very good human being. I have seen him helping people who need help. In fact, I had taken one of my old students who required help to your father, and he immediately assured me that he would help him, and he did help him. I was so happy that he had learned what I learned from my teacher. I gave it to him, and he has even excelled beyond what I am today, and today I learned few things from him. That was my expectation, and I must tell you that my teacher always said that he would be happy if I go beyond him, excel beyond him. And I said, sir, how can I do that? You are so good. He said, no, I want you to do better than me. Today I have the same feeling, and I am happy that some of my students are noteworthy to have excelled me, and they have helped me in many other ways. The way I have learned from your father, I went to Singapore as a visiting professor for 3 weeks only because one of my students is a pediatric pulmonologist there, Dr. Mahesh Babu. He recommended my name to their university, and I went there to teach for 3 weeks, during which I learned so much from Singapore Medical College as well, their national university as well. It's a give and take. in other words, I did that. And you will be surprised, in 1979, 1980, when I got a chance to join Jaslok Hospital, I thought that the intensive care is coming in India. And I had no training of intensive care. In JJ Hospital, we had a ventilator which was a negative pressure ventilator. You might not have seen one. It was called iron lung machine, where the body was in the ventilator, in the cabinet, and the neck was outside with the head, and there was a negative pressure to get the inspiration in. We were almost seeing that when the patient is about to die, we used to put him in a negative pressure ventilator and ensured that he died. We thought that was the way a human being should die. But by then the positive pressure ventilation had come, different modes had come. I had no idea what it is. When I joined Jaslok, I thought I may not be able to do it, but I must understand the principle behind it so that I can even ask the intensivist why he did that or why he did not do it. So I decided to go to Detroit, where one of my own students had become a director of intensive care. Okay, and when I wrote to him, he said, "Sir, you are welcome, you come and stay with me for 1 month." And I stayed in his house. I went with him to his hospital, and he taught me the basic principles of intensive care. How lucky I am that I have learned from my teachers and I have learned from my students. But one thing I must tell you, that when I respect what I have learned from my teachers and I continue to respect and get guidance and teaching from my students who have excelled beyond me, I must say that I learned maximum from my patients. And each patient taught me something. Okay, and I remember one of my students who came here to give an oration, he said, his first slide was, "Even the dead can teach." And he said that whenever a child has died, we look back and said, where did we falter? And then we said, we will not make this mistake again. If even a dead can teach, why not humans can teach? And I think my expectation therefore are each one should be their best. Okay, but some of them have excelled that I can learn from them. But I learned one thing, that you can learn from everyone. There is no one from whom you cannot learn. I must tell you one thing, my first teacher in paediatrics, in the first week of my houseman's post, was none other than a ward boy. And his name was Rajaram. And it was the first week of my night duty, and a 6-month-old baby came with high fever and convulsions, and I thought I must do a lumbar puncture because I was suspecting meningitis. But I had not done by myself a lumbar puncture of a 6-month-old baby. So I told Rajaram, who was on duty, that please go and call the register, because those days there was a human being had to go to the hostel to call the doctor. There were no cell phones, so there were no telephones. So Rajaram said, "Sir, if you don't mind, I will help you and you will get the CSF well." He was confident. And I said, "But I am not very confident." He said, "Don't worry. I have seen many people like you, and I know how to kind of give you a position." And he told me that he will give a perfect position which will make the entrance of the needle easy. He will kind of bend the whole back, and he gave a fetal position, and he told me, "Sir, just go straight into this." And to my great surprise, I got a clear CSF without a blood tinge. I made a mention, Rajaram was my first teacher in pediatrics. Then I realized that there were different teachers in my college. Not all were very good. But I said that I can learn from everyone. And then I learned that if somebody was useless, I learned how to be not useless. And somebody was useful. Then I read from one of the authors, and he said that you can be happy with everyone because everyone spreads happiness. I said, how can you get everyone spreading happiness? He said, most of them make you happy when they come to you, but some of them make you happy when they leave you. Even then they make you happy. So make everybody your friend, make everybody your teacher, and I think that is my feeling even today.
You make us think so much, sir. Like every single statement that you say about your thought process that goes behind every single thing makes us think like, are we, what we were thinking previously, was it even right? Should we just change everything how we were thinking? But anyways, this one thing that you always mention, you were a part of Grand Medical College for quite a long time, and the emblem of Grand Medical College has something inscribed in Latin which you have mentioned many times in many of your lectures. So if I'm not pronouncing it wrongly, it's said as mens sana in corpore sano. So which means a healthy mind in a healthy body, and you are one perfect example of that. So what are your thoughts on that? Like, do you feel that by that do you mean that you should be physically fit in order to be mentally fit, or what goes on when in your perspective?
I think when I joined Grand Medical College, I did not understand what it meant. First, I did not understand what that emblem meant when I read that, but then I realized that it's healthy mind in healthy body. Then I started wondering over years, not during my training, but it came as I started thinking more and more that we were taught by the modern medicine, Western medicine way, and that is we were given emphasis on disease more than health. We learned anatomy and physiology just for a year or year and a half, and thereafter we almost thought that is of no great use, only a little clinical application. As the age advanced and as the knowledge kind of started gathering, I realized that that was the most important part to learn, and that was given the least time. Then I looked at some of the Ayurvedic principles. I'm not an Ayurvedic or a homeopathic. I'm very proud of my Western medicine training, because I feel that Western medicine has advanced so much. But I looked back. My father was a family physician, and I saw few things. One is he would always concoct a separate mixtures for every patient. So if 5 patients came with cough, he had made 5 different kinds of combination mixtures for 5 of them. I wondered why, and he said every individual is different. I did not know that, because I was trained to kind of give them a prescription of one cough mixture which was supposed to be fit for all. I realized that it was not fit for all. So first thing I realized that we were not taught what we should have been taught in Western medicine. And I feel that's the biggest disadvantage of a person who has only studied Western medicine. Dr. Athavale was one of our senior teachers and one of our very popular pediatricians of this city, and he went on. He was in the merit list at the SSC board. He was one of the toppers all through, and even then, after becoming a pediatrician and having a roaring practice, he started learning Ayurveda. And he learned Ayurveda and he passed Ayurvedic examination. Once I asked him why did to do that, he said Ayurveda has taught me something different. And then I realized that Ayurveda is a science of life, not the science of disease. Western medicine is a science of disease. And in Ayurveda, the emphasis is on health and not disease. My juniors want to rule out every possible disease to say that, yes, you are a healthy person. And to do that, he has to do a lot of tests. So I think that is where I started learning that health is not something easy to understand. And our emblem said, healthy mind in healthy body. Then mind is an organ which we were never taught. If healthy mind is so important to be in healthy body, then why we were never taught about mind, and we never asked about mind, as if mind was not an organ. Well, after realizing all this, after becoming a pediatrician, after trying to teach students, I realized that we are not teaching completely what we want to teach to make them good doctors. Because I myself did not know where the mind is. I did not know anatomy, physiology of mind. How will I know pathology of mind? And therefore, I started studying mind. And I realized a most important part, that if your mind is not at peace, your mind is not cool, if your mind is not strong, if your mind is not happy, then you are not going to be healthy in life. That's what my emblem of college men, a healthy mind in healthy body. We learnt only the organs like the brain, heart, liver, etc. But we were never told that there is mind as another organ. It is the mind that stimulates the immune system to attack the disease in a healthy way. Today I know, and you know well, that immune system can damage as well as heal. And it's a balance between an ability to destroy, an ability to kind of repair, an ability to conserve is called an immune balance. When this balance is lost, you get a disease, and when the balance is further lost, you get killed by that disease. But if the immune system works in favor of the body, then you come out of the disease, you come out of complication, you come out of ICU. I thought patient got better because of me and my disease, my diagnosis, my treatment. But not every one of the same kind was saved by me. I wondered why he died and why many others survived. I did not understand why. I thought his age was different, nutrition was different. No, I saw similar age, similar nutrition, similar weight, similar height, looking similar, but coming out with different performance in spite of the same method that I used. In an ICU during COVID, healthy people went more often there than unhealthy patients. Why was that? So I started studying immunology. Not immunology of diseases. Your wife is a big immunologist. She knows far more than me. My immunology understanding is only related to a life, related to disease, related to health. And I realized that if immune system behaves ideally, you come out of a disease. You will be surprised. I learned with some literature survey that mind decides how immune system should work. And if the mind of a patient is strong, is cool, if he is comfortable, if he has a faith in his doctor, if he is sure his doctor will cure him, he starts getting cured. So I realized healthy mind in a patient is important to make his body healthy. That means when I see a patient who has a disease, his body is not healthy. But if I make his mind healthy while I make his body healthy, well, if there is a pneumonia, I will cure pneumonia. But if it's a degenerative disease, if it's an autoimmune disease, can I cure? No. I will only control, I will only suppress. Then who will make him much better? His mind. Therefore I said, a good doctor should address the mind while treating. To make the mind of a patient healthy, so that his damaged body also becomes healthy, was an emblem in my college days, a healthy mind in healthy body. And I realized for that I must spread the knowledge to my young doctors that let your mind be healthy and committed to make the patient's mind healthy. And how do I make the patient mind healthy? I must address his concerns, I must address his fear, I must address his guilt, I must address his shame.
In many of your talks, you say that medicine is an art and not a science. And you are a very strong believer in that medicine is just not a science, it is how you put it. And even our previous discussion, it is more or less, it is conveyed in a way that you feel that it is not just A plus B is equal to C, 1 plus 1 is equal to 2, it's not as easy as that. What are your thoughts behind that once you say that medicine is an art?
No, medicine is science.
More
but
than science.
Medicine is also art.
Right.
Okay.
Right.
And we never learned art. We learned only science. So the basic problem with our training is we learned half the truth and not the whole truth.
Okay.
That is number one. Second thing is the science and the Western science that we practice is going so fast, advancing so fast that what I learned 60 years ago, not only it's obsolete, but what I learned 5 years ago is getting obsolete. With the result that I have to keep updated in medicine, in science, so much so that I have to learn, unlearn and relearn. Not easy. And for a generalist it's most difficult because I need to know the advances from head to toe. As a pulmonologist, you will also have to do that, but you know the depth of pulmonology, a bit of others. But I need to know a bit of everything. How can I keep updated? You yourself as a super specialist cannot keep updated in your own small field. Science is advancing so fast. So I thought that science is doing extremely well, but no one in any speciality or generality can really understand whole science. So everybody is fragmented. That's why when I went abroad, for every organ that is showing symptoms, they needed a super specialist. So if a cardiologist patient gets cough, he calls a pulmonologist. No, it's a cardiac problem, but it's rooted through pulmonology. Okay, if an asthmatic has a running nose or blocked nose, do you know an ENT man? No, but today's generalist knows that, but a super specialist may not. He would say, better call an ENT to be sure that there is nothing else in the nose. So we are getting fragmented. And science has that limitation that it's advancing so fast, nobody knows. And if that is so, we are only learning science, and most of the great scientists in every field all over the world have said one thing in common. And Einstein said, so also many other scientists said, that as I came to know more and more, I realized how less and less I know. If this is so, I understand science is advancing, but I cannot keep pace with it. That's the one biggest disadvantage of advancing science. I look at what is applicable to me in my general practice. The rest I don't. And I can bet 90% of advances in medicine that is applicable to my general practice, I know it well. 10% I don't even try to know well, I send it to somebody who knows well. And that is why you have to be selectively updating in science today. So science is great, science is a must, but science has a disadvantage, you can't keep pace with it. In fact, one of the authors that I read has put it so well, and he said, if you are not scientifically updated, take your academic pulse, you may be already dead. He called it an academic pulse. And another author has said that to keep up to advancing science, you have to run twice as fast to realize that you are at the same place. You run twice as fast to realize you are at the same place. That means you are not advanced. This is science, and we are only after that. But look at the art. The art of medical practice consists of two things: an art of clinical bedside medicine, history taking, thorough physical examination, art, and the art of human and doctor's behavior, which means holistic care, empathy, compassion. Empathy is not sympathy. Sympathy is at the spinal level. Empathy is at the cortical level. I should realize what that patient must be feeling about his disease. And I get into his shoes and I start feeling. That is empathy, more than sympathy. But compassion is one step further. And what is compassion? I should not only feel empathy, but try to understand how I can help him to solve his problem. That is compassion. This is art. Communication and counseling, I talked about it. All this indicates honesty on the part of the doctor, transparency, dedication, commitment. If all this is known across to my patient, patient starts feeling I am at the right place and my doctor will cure me. Many times you must have also seen and heard that patient said, once I come to you, I am sure I will be all right. What a faith! I may not be sure that I will cure him. He is sure of himself. And this is important. I must tell you a real story that happened that I remember so well. A mother was asked to come to me by somebody who referred her my name. I did not know her. She took an appointment and came. And I spent an hour with that patient because she was so worried, and I was sure that it was not so serious a problem. But they had done a lot of tests, but they had not done the tests that were required to be done. So problem was not so serious, but she thought it was serious because her child was not getting better. When I spent an hour, and I thought she was very happy, I made her confident that your child is going to be all right in the next 2 weeks. And when she got up, she almost had tears in her eyes. I asked her, "Madam, are you still worried? Why did I see you crying?" She said, "Sir, I did not cry because of my worry. I am now sure my child is going to be all right, but I cried for some other reason." I said, "What was the reason?" He said, "I stay in Dombivli and I travel by train to VT to my work. And I was telling my colleague, my friend sitting next to me, that I don't even feel like going to work. When I'm working, I'm not really mentally there. I'm always mentally with my son who is ailing. No doctor has known what is wrong. He's not getting better." When she was talking to her neighbor friend, a lady sitting across her seat was hearing all that. After some time, she told this lady that, "Madam, I have been listening to what you are talking to a friend. If you are worried, I will give you a name of a doctor to whom you go." She gave, unknown lady gave my number to this lady. She phoned me. She now knew that I had spent so much time. She had told me, "Sir, nobody has spent even 5 minutes with me. You spend so much time. I am sure now my child will be all right." Then she said, "You know why I cried? I never asked this lady's name or telephone number. I would have phoned right from here to tell her that, 'Madam, you recommended the doctor. I am so happy. I came to him and I am sure now my child will be all right.'" That is the blessing that you get. Unknown person talks to somebody unknown and tells them, and then you stand by that and you prove that unknown person that that person's recommendation was right. Nothing better than that blessing. This is, I think, what we must learn in art of practice. Okay, and art of practice makes the patient happy, but also the doctor happy. And if I am happy, I can make others happy.
Yeah, that was really touching. I'm pretty sure how emotional you must have got at that point of time when these things happen, when an unknown person is recommending your name for just not even asked, like just by a side conversation, right? So many of the patients must be talking to you like, "Sir, doctors are next to gods. Doctors are next to gods. Like, you have cured my child, you have taken my child out of all the ailments." What is your belief in spirituality, sir?
Actually, see that every doctor wants to be successful and curing his patient. His intentions are very clear, but he does not put the best efforts to make his intentions come out right. That's the problem. No doctor wants that his patient should die. No doctor wants his patient gets into complication. No doctor wants to miss the diagnosis. Even then he misses. Why? Not because he has no knowledge. Okay, he has knowledge, but he does not commit to use the knowledge. And why does he not commit to use the knowledge? Because of many wrong reasons. First wrong reason is, "Sir, I have no time." Late Dr. Merchant, who was one of the best pediatricians in the city of Mumbai, once told me that the most busy person has always time for everything. I said, "Sir, how can that be?" He said, "Yes, because most busy person knows he has a lot of work to do, so he has planned his work perfectly. Yeah. He is never short of time. So don't say you have no time. Right. Create time." Okay. Then I realized that when a surgeon tells a patient, "Your surgery may take about 45 minutes to an hour, don't worry." But suppose that surgery took 2 hours. Would he stop at 1 hour and say, 1 hour is over? Then how can a physician thinks that he can do away with the patient in 20 minutes, but needs 40 minutes? How can it not give him 40 minutes? But sir, I have so many patients. Then I told him, the way I manage, If I know that every patient must get 20 minutes minimum to 30 minutes, then I should give in 2 hours only 3 or 4 appointments and keep a free time.
To talk.
If there are no patient, I relax, I talk to my friend, I take a cup of tea, I don't waste my time. I rejuvenate so that in the next 2 hours I am again fit. And if I need that extra time, I am never short of time. I realize throughout my career, I used to give appointments with every 2 hours, 120 minutes, 30 minutes appointment blank.
Okay.
And if that blank was not used for the patient, it was used for myself. I would read a newspaper. I would listen to some music. I would not wasting time. And I think there are methods. But then there are a lot of patients who want to come to you. To begin with, you have no patience. You have time. Thereafter, you have patience. You have no time.
No time.
Okay. But the funniest part of medical life is, when I started my practice, I had no money. Okay. I had a lot of energy. I had a lot of time. But no money. So I was unhappy. I waited for patients. Every evening I went to my clinic, came back without seeing a patient. In the morning I was at JJ, it was the most enjoyable time. I was in the midst of patient, I was in the midst of training, it was a happy time. Evening was a very stressful time. I still had energy. I had money by then and I had no time. Again, an imbalance between time, money and energy. In my first phase, no money. In my second phase, no time.
No time.
When I became old, I said,
Both.
now I have money. Now I have time. I have no energy. All of us make that biggest mistake, that you must have a balanced life. Immune system should be balanced.
Right.
Our practice also should be balanced. What does it mean? When I start getting more practice, I must find time because I have energy and I have money. I followed that. Today when I go only for a short time, I see all my old patients. They come and meet me for 2 minutes and they thank me for showing them my colleagues, and they say, sir, they are as good as you are. I feel proud of that. I am not unhappy because at my age I have money and time. I have money and energy. I wanted time to myself. I bought time by giving money to others. Not donating them, giving them opportunity to earn more money. Everybody is happy. When I started going to my clinic less number of times in a week, my colleagues were happy because our system is whoever sees a patient collects the fund. No share there. So he said, no, take it easy, go out for another 2 days, no problem. I am making him happy.
Yeah.
Because he is getting more money when he needs more money. I should not get more money when I don't need more money. And if I have more money, I can't use it. I will leave it to my next generation, and the third generation will be ruined and spoiled. They will say, grandfather has kept so much money. It is best I don't keep any money.
So as we come to the end of our discussion, I want a very quick 2 questions with you, sir. First is, if not a doctor, what do you imagine yourself as?
I am not sure what I would have done, but looking backwards, that what are my merits or virtues, even in medical practice, I thought my strong merit and virtue is I am able to convince a patient, give him confidence and address his mind. I thought that's what the lawyer has to do. And therefore, retrospectively, I thought I could have been a better lawyer. But I don't like that branch at all, only because a lawyer has no choice but to defend his client, and even if he is a criminal, he is defending his criminality.
He's doing his job.
Which is not acceptable to me. But I realized that I have. Another thing that I could have done is I could speak well, I could convey people well. So I could have been in an area where you need to be a good orator, you need to be able to convince your point, and therefore I wonder whether I could have been a good politician who can give a good talk. But that is not my cup of tea, so I am very happy I am a medical graduate and a medical practitioner.
As you said that you are an excellent orator and you have written a lot of books. but amongst the ones that I have read, this book is the best, sir. So I've been reading this book for almost 2 months now, and the things every time I go through, there are a few chapters. We have divided this book into 3 parts. So first is an insight of a doctor, second is case based, and third is your concluding part. The first part is the most interesting according to me. Every time you read it, you find something new, you learn something new. So hats off on this, sir. Last thing, I would like to end this interview saying that any life advice, any critical life advice that you would want to share, just to summarize the talk, sir.
I think the bottom line is everyone in life, including medical practitioners, but everyone in life must try to make himself happy and not merely successful. Success is different than happy. And what is different? Success is what others see in you, but the happiness is what you see within yourself. Happiness is what you feel. Success is what others make you feel. And this is the biggest difference. And success, if you go after it, you might get ruined, because success cannot be guaranteed each time, but happiness can be guaranteed each time because it's within you. And finally, a message would be, happiness lies, you don't have to go after it, but the success lies in happiness. If you are happy, you are successful, but you may not be happy even if you are successful otherwise. And I'll end up with a story, a real story. One of the pharmaceutical CEOs, whose child I used to see, phoned me to say that he is asking 10 doctors in India to put up their kind of a small autobiography, which will, according to him, inspire the young generation of doctors. And he said, I know you are a successful doctor, so I want you to also contribute to this book, and I am going to publish it and give it free to all the doctors. I just heard of him, and he said, I will send my manager to you and he will give you the details. His managers came and they said the same, sir, you are successful, so my boss wants you to write a story of success. I said, why do you think I am successful? He says, well, everybody knows. I said, no, I don't know. Tell me why I am successful. He did not know that. He could not tell me. Then I gave him the definition of success and definition of happiness. Success is what you want to get by hook or crook, by doing wrong or right. That is success. But the real happiness lies in success. What kind of success? I want to get what I want is what I get, and what I want is what I need. If I want what I need and I get it, I don't need more than that. And if I am happy with what I get, then I don't care what more I could have got. That is why I said the success lies in happiness, but you must know the story of success, definition of success. So success ideally is you want what you get, you want what you need, and not you need what you want to get. Two things are different. That's my last message.
Thank you so much, sir. Thank you so much, sir, for sharing all the insights. It's always been indeed listening to you in all your talks, and conversing you face to face has been a pleasure. Thank you so much, sir.
Thank you very much. I must end up by saying that I have known your father well, and he has exactly done everything what I said and even a bit more. So you have an inheritance and you have an environment. So epigenetic factors and genetic factors put together, you will excel one day even beyond your father. And if I am alive, I will tell somebody, not only my student has excelled, but his son has also gone beyond it. I wish you and your wife all the success, and the success lies in your happiness. So be happy. Success will follow you, will be after you, but you don't have to be after success. You have to be after happiness. Thank you very much.
Thank you so much.